The first jab from AstraZeneca has now been done, Stephen.
Yeah, morning, Peter. It's an exciting day, not just for Murray Bridge, but for South Australia and the nation. This is a milestone in the national vaccination program. Most Australians will receive the AstraZeneca vaccine, particularly in rural and remote communities. It will be fundamental to our vaccine rollout. So we're really excited that the first AstraZeneca vaccination in the country is in country South Australia at Murray Bridge.
So what's the targets?
Well, the Commonwealth received 300,000 doses last Sunday. We received 20,000 doses on Wednesday, and here we are less than a day and a half later. We're administering them in our hospitals. My understanding is that the domestic production of AstraZeneca vaccines will commence in late March with about 1 million doses a month. I appreciate there would be concern in relation to the Italian EU shipment block, but I've spoken to the Federal Health Minister this morning, and he's assured me that the 300,000 doses that were received last weekend will be enough to deliver our vaccination program up to the commencement of domestic production at the end of March. So we're going full steam ahead. We'll be establishing AstraZeneca clinics both in the metropolitan and the country South Australia next week. This is really exciting. We weren't expecting AstraZeneca to be available as early as this in the rollout, so we're both rolling out Pfizer clinics and AstraZeneca clinics.
So you believe that the disruption from Italy holding off on 250,000 doses will be minimal?
Well, the advice that I have is that it won't affect the vaccination rollout. Let's be clear, this is one shipment from one country.
Big shipment, though.
We've received 300,000 last weekend. The advice I've got is that it won't affect the distribution particularly because we've got domestic production starting at the end of the year. Not only has the Commonwealth Government been working since the middle of last year to secure the supplies going forward, but also to make sure that we can have domestic production. That is a great boon for Australia. It means we've got much greater security of supply as we go into the latter months of the vaccination program. I'm very confident that every South Australian who wants a COVID vaccine will be offered that opportunity this year.
Does South Australia have a quarantine bill for New South Wales, Stephen?
Well, I appreciate that it's not uncommon for health services to cross-charge each other. Certainly, that was my expectation in relation to hotel quarantine. But to be frank, that's a matter for Treasury departments, not health departments.
Yeah, but I mean, if there is a bill, would you be happy to see that paid to New South Wales?
Well, as I said, we reimburse other states and territories for the services they provide to South Australians in health all the time. So it wouldn't. I am expecting a bill, and my understanding was that there was an expectation of cross-charging in medi-hotels as there is for health services generally.
Okay, and as for travel caps, do you expect to increase those in South Australia?
We don't have any plans to increase our medi-hotel capacity. We've got a number of challenges for the health system, in particular the vaccination program. This is the largest logistical operation in peacetime, and many of the health workers who would be needed for an expansion of the medi-hotel capacity would also be needed for expansion of the vaccine program. So we need to deploy our resources as effectively as possible, and I'm not aware of any plans to increase the medi-hotel cap.
Okay, no plans to increase the cap in South Australia. Stephen, thanks for joining us. Talk to you soon.
Thanks, Peter.